Grahame Morris.
Thank you very much, Ms McVeigh, and thank you for calling me in this important debate. And I would like to thank the Honourable Member for North Warwickshire for securing this important debate. We are from the same part of the country, Ms McVeigh, but we're from different tribes. I'm red and white, and but this is a really important subject, and it's important that we address the issues. We're living through an unprecedented pandemic, and I was very saddened and alarmed to read yesterday that the UK became one of only 5 countries to exceed 50,000 COVID deaths as a consequence of the pandemic. But there's no doubt that in the fullness of time we will have a public inquiry into Covid-19, and that will examine the way in which, and in fact the flaws in the government's Covid response. And I certainly believe that the government will acknowledge that they weren't properly prepared for a pandemic and didn't have a proper and effective plan to manage infectious disease and routine day-to-day healthcare. The impact on breast and other cancers already has and will continue to cost lives. But I want to focus on the cancer recovery plan. The government can take steps to avoid unnecessary cancer deaths arising from the backlog of delayed diagnosis and treatment. I have met with the Minister on several occasions in my capacity as Vice Chair of the All-Party Group for Radiotherapy and Vice Chair of the All-Party Group on Cancer. And I think we've had a constructive dialogue. But the Minister won't be able to argue, I'm afraid, that solutions weren't put forward to address this issue and to mitigate potential deaths and arising from delayed treatment. I want to mention the Catch Up with Cancer campaign, the Radiotherapy for Life is supporting, which has identified that the cancer backlog stands at over 100,000 patients. I did meet quite recently by Zoom with Macmillan Cancer Support. I'm one for badges. I'm wearing Radiotherapy for Life and Macmillan to discuss the needs to discuss what needs to be done to address the cancer backlog. And Macmillan are estimating there are 50,000 missing diagnoses, the hidden C they're calling it, for cancer across the UK. An estimated 100 fewer women starting treatment for breast cancer each working day in May and June compared to last year. Breast cancer two-week wait referrals is down 25% in March to August of this year compared with 2019. In the call, I was joined by a representative from the Macmillan Joining the Dots campaign, a lady called Chloe Shaw, who's doing excellent work, and it's a brilliant local service which may well be available in other parts of the country. It offers practical help and support to people affected by cancer, in my case living in County Durham and in my constituency in Easington. Joining the Dots supports people in my constituency who were living with cancer throughout the pandemic and at the moment having to work primarily through telephone and video calls. Macmillan estimate that there are currently almost 18,000 people living with and beyond cancer in County Durham. People have already been diagnosed, many fearful that there may be a reoccurrence. And the estimate is that this figure could rise to almost 29,000 by 2030. So as Vice Chair of the APPG for Radiotherapy, I'm particularly interested in this issue, and we have in the Westminster Hall today a number of former ministers, and I've been banging this drum for some time. And the particular issue now is about the impact of the pandemic on the availability of radiotherapy treatment. And as I mentioned, particularly for many older women with breast cancer who haven't been prioritised to receive radiotherapy over the last 6 months, we really must do something. And the data is available and it should be acted upon. I would ask the Minister if she would publish those data sets. Okay. If I might just conclude very quickly, the final point I want to make is we certainly need smart solutions and investment, but we need that to be reflected in a comprehensive spending review. And I do hope the Minister will make the necessary representations to the Treasury. Thank you.